everybody. Happy Tuesday. Good to see you all. Hope y'all are doing well. It's so hot, guys. I'm telling you, I hope y'all are staying cool because it is hot. And I forgot to tell you guys on the 21st of June, happy summer. So I'll tell you guys now, happy summer. Unfortunately, I can't stand the summertime because it is too stinking hot. So hopefully everybody is staying cool. Whew, Lord. Make sure y'all hit that like if y'all are coming in. Thank you guys so much for being in here. Let me go in and say my hellos to everybody. Hello, Rebelicious. Good to see you, honey. Hope you're doing well. Hello, Rocket Queen. Good to see you, love. Hope you're doing good. Hey, Wild Angel. Good to see you, honey. Hope you're doing good. What's up, the real Slim Skittles? How are you, honey? It's so good to see you. Thank you so much for being in here, honey. Hello, Criminal Meg. Good to see you, love. Hope you're doing well, darling. Please be careful, Rocket Queen, honey. Please be careful. You're driving. Hello, Summer Thunder. Good to see you, love. Hope you're doing well, darling. Hey, Juju. Good to see you, honey. Thank you so much for coming in here and saying hi. It means a lot. Hope you're doing well, darling. It means a lot to me that all you guys are in here. Thank you guys so much. Hello, Sub-Zero. Good to see you. I'm going to put that up on the screen. It says, hey, Tattoo Angel in chat. There's so much darkness in the world. Let's all try to be a light for others and I got the hiccups and ourselves. Thank you so much, Sub-Zero. That's excellent. Thank you so much. Well, the real Slim Skittles, you better be bringing us some cold water over here, sister. What's up, Footloose Will? No, you're not late. It really just starting. Yeah, it's really just starting. It's good to see you. I hope you're doing well. Thank you so much for being in here. Yes, we're just starting. We've been like 8 minutes in. That's it. So you're good. Thank you so much. Thank you guys so much. Make sure you guys hit that like and share and subscribe if y'all haven't done so. Thank you guys so much for being here. It means more to me than you guys know. Seriously, it does. All right. Well, as most of you guys know, I am afraid of certain things, and I think a lot of people are afraid of certain things. So I wasn't asked to do it, but I figured that it was good to talk about. That's good, Footless Will. I'm glad you're in here. Thank you so much for being in here. Don't let it snow. Yeah, let it cool off or something. I'm telling you, it's hot. But yes, we're talking about tonight, what is your phobia? If you have a phobia, like, what is it? What are you like afraid of, or what is your phobia? And it says tonight we're going to talk about what is your phobia? How important is this to your mental health and well-being? So I'm going to pull up the screen, and we are going to go over what phobia is and bring awareness to that, and kind of like the side effects of a phobia, and a list of phobias. And some of them I might not be able to pronounce, but thank goodness in heaven that it says what it is beside it. So if I cannot pronounce it, y'all can see it on the screen. Y'all can try to pronounce it for me. But some of them, I will try my very best. Let's put it that way. I will try my very best, guys. So let me pull up my screen, and let's see what we got. Like I said, thank you guys so much for being in here. All righty. Okay, phobia. This is from clevelandclinic.org. It says a phobia is when you have intense or even overpowering fear and anxiety in certain situations, or when you encounter certain objects. While phobias can involve the same thing as ordinary fears, the effect of phobias are more severe. In most severe cases, people with phobias critically limit their lives to avoid encountering what they feel. This is an overview of what phobias are. says, what are phobias? A phobia is when something causes you to feel fear or anxiety that's so severe it constantly and overwhelmingly disrupts your life. Phobias are a type of anxiety disorder, and there is one diagnosis for almost all of them: specific phobia. Only one phobia, which is agoraphobia, is a specific diagnosis. When you aren't in a situation that directly involves your phobia, you can recognize that the fear is much more severe than it should be, but knowing that doesn't change how you feel. If you encounter something that triggers your phobia, you'll feel overwhelming fear or anxiety. You might be able to keep functioning, but doing so will be extremely difficult. How many different phobias are there? Because phobias, including the feelings of fear or anxiety they cause, affect everyone differently. There is no set number of fears. However, experts group fears into 5 main categories. First category is like animals: alligators, dogs, snakes. This is the examples of the phobia. Natural environment: heights, storms, and water. Blood, medical procedures or injuries. It's needles, sharp objects, or pain. Situations: driving, flying in close spaces. Other: children, choking, and clowns. This is the most common phobias. Some of the most common phobias by category include: this is an animal. This is arachnophobia, fear of spiders. Cynophobia, fear of dogs. Entophobia, fear of insects. Ophidophobia, fear of snakes. I'm probably not pronouncing these right, guys, but I'm trying. Hello, Packers fan. Good to see you, honey. Hope you're doing well, darling. Haven't seen you in a while. I hope you're doing real good, sweetie. Hello, Miss Pat. Good to see you, honey. Hello, Demetrius. Good to see you all. Hope everybody is doing well. This is acrophobia, fear of heights. Agoraphobia, fear of public spaces. Aquaphobia is fear of water. Astrophobia is fear of thunder and lightning. Logophobia, fear of pain. Dentophobia is fear of dentists. Hemophobia is fear of blood. Trypanophobia, fear of needles. Aerophobia, fear of flying. And maxophobia, fear of driving. Claustrophobia, fear of enclosed spaces, which I know most of you guys probably already know that one. Nyctophobia, fear of the dark. Claustrophobia is fear of clowns. Emetophobia, fear of vomiting. Pyrophobia, fear of fire. Trypophobia, fear of clusters or groups of holes. Yeah, I got it, Demetrius, honey. I was door dashing today and driving. I haven't got to message anybody back yet, but I will, honey. And I got yours too, Criminal Mad, sweetie. But I was starting my stream when they was coming in on my tablet. So I will message you guys back when I get a chance. Agoraphobia. Agoraphobia is a specific diagnosis because it can have many potential triggers. A diagnosis of agoraphobia requires that you experience multiple types of triggers. The 5 all relate to being in public areas or spaces. How common are phobias? While it's common for people to describe having a strong fear of something like snakes or heights, that's not the same as phobia. In reality, phobias aren't very common. Specific phobia. The rates for specific phobia can vary by age. However, most people develop them before age 10. Oh my goodness, honey. Lord have mercy. Well, it is so good to see you, Miss Tori. Yes. So good to see you, darling. And you know you're welcome to come in here anytime you want to. It's just so good to see you. I'm glad that you're doing well, other than work. And third shift, oh Lord, I bet you that sucks. But I'm so glad to see you, and I'm glad that you're doing well. Just don't work too hard, honey. Overall, only about 8% to 12% of people in the U.S. meet the criteria for specific phobia. Everywhere else in the world is between 2% and 6%. children worldwide, between 3% and 9% of children meet the requirements for specific phobia. Among teenagers between 13 and 17 years in the U.S., about 16% have it. Older adults, 65 and older, specific phobia rates tend to decrease as people age. Estimates range between 3% and 5% for people 65 and older. Women and people assigned female at birth, AFAB, are twice as likely to have specific phobia than men and people assigned male at birth, AMAB. Symptoms and causes. What are the symptoms of phobia? Specific phobia and agoraphobia have the same possible symptoms but can happen in different ways or settings. Phobias can cause you to experience physical, mental, and behavior symptoms when you're exposed to the fear object or situation and or when thinking about it. You're welcome, Packers. Lord have mercy. You're welcome, Miss Tori. Much love to you, darling. It's so great to see you. Intense or overwhelming fear, panic or feeling the need to escape, feeling like you're in immediate danger, feeling of disconnection from your body, depersonalization, or the world around you, which is derealization. Physical symptoms are effects that directly affect your body. They include heart rate and activity changes, sweating, feeling hot or chills, shaking or trembling, nausea, upset stomach and stomach ache, tightening or pain in your chest, trouble breathing or feeling smothered, feeling dizzy or lightheaded, fainting, pallor, blood rushing out your face, narrowed vision, also known as tunnel vision. Behavior symptoms are ways you change or don't change your lifestyle, routine, or habits. They include going out of your way to avoid triggers, example, avoiding regular medical or dental care because you're afraid of needles, dentists, etc. Deliberately changing your life to avoid triggers, example, moving out of a coastal area because of the fear of hurricanes. Avoid life changes, especially positive ones, so you don't encounter triggers. Example, avoiding buying a house or taking a job somewhere with a view of the river, lake, or ocean because of the fear of water, swimming, or drowning. Phobia symptoms in children. Children can also develop specific phobia, and they may not show different symptoms, including crying, tantrum, or emotional outburst, freezing, holding still, clinging, or being inseparable from someone they feel safe. What causes phobias? Phobias are when your brain takes fear and anxiety to extreme degrees. Under ordinary circumstances, these emotions can be protective and helpful. They're your brain's way of warning you that something is wrong and you might be or currently are in danger. But experts don't fully understand why these emotions can turn into phobias. However, several factors and processes may contribute to having a phobia. These include traumatic experiences. These can be experiences that happen to you or that you have seen happen to someone else. Genetics. Certain types of phobias are more likely to happen in people who have a relative with that type of phobia. The types with higher rates and family members are animal, blood, medical procedure, injury, and situational phobias. Informational transmission. Some phobias may happen because of things you learn about or things you see or hear repeatedly. Learned fears. People can learn about phobias or fears of others and may develop a phobia as a result. This may be a factor in why people with overprotective parents may be more likely to have specific phobia. All right, Miss Tori. What are the complications of phobias? Phobias can have long-term effects on your mental and physical health, especially when you frequently encounter triggers or has especially severe effects. People with specific phobia and agoraphobia have a higher risk of certain mental health conditions. While phobias may not cause those conditions, phobias usually start before the other conditions and can contribute to them. Mental health conditions that are more likely in people with specific phobia or agoraphobia include anxiety disorders, bipolar disorder, depressive disorder, personality disorder, especially dependent personality disorder, substance use disorder, somatic symptom disorder. Physical health conditions that commonly happen along with phobias or that may get worse because of phobia symptoms include heart disease, chronic obstructive pulmonary disease or COPD, Parkinson's disease, balance and dizziness symptoms, which can also cause falls and fall related injuries, degenerative brain disorders, and dementia symptoms. Diagnosis and tests. How our phobia is diagnosed. A mental health provider, usually a psychologist or a psychiatrist, can diagnose specific phobia and agoraphobia by talking to you and asking questions. Diagnosing these conditions doesn't require lab imaging or diagnostic testing. The questions they ask may follow specific questionnaires designed to help diagnose a phobia. The questions they ask can include, but are not limited to, phobia triggers that you know about, what symptoms you experience, and how severe they are, your current lifestyle and routine, and if phobia symptoms affect it. When the symptoms started, if you have a history of traumatic event or other possible factors that could cause or contribute to a phobia. Your provider will ask these questions because diagnosing specific phobia or agoraphobia requires that your symptoms meet certain criteria. Specific phobia criteria. You experience strong fear and anxiety about a specific object or situation. Encountering a phobia trigger causes immediate fear, anxiety, or both. You actively avoid phobia triggers or experience intense fear, anxiety, or both. When you encounter triggers you can't avoid, the fear and anxiety you experience is much more severe than the trigger should cause. You experience fear and anxiety from triggers or work to avoid them for at least 6 months. The fear, anxiety, or avoiding phobia triggers disrupts part of your life, including work, social relationships, etc. Oh my goodness, Miss Tori. Prayer, sweetheart. The symptoms you experience aren't better explained by another condition such as post traumatic stress disorder, PTSD, or panic disorder. Management and treatment. How are phobias treated and can they be cured? Treating phobias can involve mental health therapy. The formal term is psychotherapy, medications, or a combination of the two. The treatments can depend on the type of phobia you experience, how severe the symptoms are, and factors related to your lifestyle, routine, and preferences. A healthcare provider can tell you more about the possible treatments that can help you and which they recommend. Psychotherapy, one of the main ways to treat phobia is helping you adjust your thinking and behavior surrounding your fear. Mental health therapy or psychotherapy is one of the most useful ways to do this. Cognitive behavior therapy or CPD is a common type of therapy that helps with this. Over time, therapy can help you better cope with the fear and anxiety you experience. Exposure therapy. Another treatment approach is exposure therapy. That can happen in two main ways: systematic desensitization, graded exposure. This involves gradually exposing you to parts of triggers slowly. Over time, your provider will help you work through parts of your fears from least to most troubling. It also helps you practice adjusting your thinking and behaviors to manage feelings of fear and anxiety. Flooding. This technique is similar to desensitization, but it involves exposing you to phobia triggers themselves, not in small bits over time. That helps you to adjust to triggers and control your anxiety. Though less common, this technique can sometimes help people with phobias, but most providers recommend using it cautiously. Exposure therapy can happen in two ways: in vivo, from Latin, in this context means in real life. Exposing yourself to your fear in real life is one way that you can work through it. Imaginal. This is where your provider has imagined your fear and helps you process and work through the fear by thinking about it. For some phobias, this is the only way to use exposure therapy, especially phobias that would be dangerous to be around in real life. Medications. In some cases, certain medications can also help with your phobia symptoms. These are usually depression medications or anxiety medications. Many types of medications can help you with phobia symptoms, so your healthcare provider is the best person to explain your options and which they recommend. They can also explain the possible side effects, complications, and other details you should know about these drugs. Prevention. Are phobias preventable? Phobias happen unpredictably and they can vary widely from person to another. That's partly because fear is something that each person experiences differently. Because of that, there's no way to prevent phobias from developing. There's also no known way. Oh, Lord. Your known way to reduce your risk of developing them. Over outlook or prognosis. What can I expect if I have a phobia? Phobias can majorly impact your mental health and well being, especially if they involve something you encounter often. About 75% of people with specific phobia also have more than one type of phobia, which can make this condition very disruptive. Over time, untreated phobias can cause some people to limit their lives severely. How long do phobias last? Over time, specific phobias can fade. However, this is less likely to happen without treatment. Phobias that start in childhood may fade away quickly, but childhood phobias that last into adulthood can last for years or even decades. What's the outlook for phobias? The outlook for specific phobia is best with treatment, especially early on. Without treatment, these conditions can greatly impact your mental health and how you live your life. Early treatment for phobia symptoms can make a major difference, even if you don't have an official phobia diagnosis, because you haven't had symptoms for at least 6 months. This is true no matter what your age or phobia you have. Living with. How do I take care of myself if I have a phobia? The most important things you can do if you think you have phobia include seek help. You should seek help as soon as you notice phobia symptoms disrupting your life. Getting help sooner can make a big difference in your recovery. Follow treatment guidance. If your healthcare provider prescribes medication or recommends regular mental health visits, follow them can make your treatment more effective and help you faster. Don't underestimate the value of lifestyle changes. Staying active, eating a healthy diet, getting enough sleep, avoiding alcohol and non-medical use of drugs, and managing your stress and mental health can all help you as you work on overcoming a phobia or phobias. When should I go to the ER? Phobias can increase your risk of anxiety, depression, and other mental health conditions. Those conditions can in turn increase your risk of self-harm or unalive yourself. You should get immediate help if you have thoughts about harming yourself or others. If you suspect someone you know is in danger of harming themselves. Resources that can help you include National Suicide and Crisis Lifeline in the United States. And this is the info right here. 911. You should call 911 if anybody's in immediate danger. A note from Cleveland Clinic. You might feel that having a phobia is a major flaw or sign of weakness, but it isn't. Phobias are widespread and can affect everyone regardless of age or background. Just as there's nothing wrong with seeking treatment for a broken bone or an ear infection, there's nothing wrong with seeking a mental health professional for help with phobia. If you have or think you have a phobia, talk to a mental health provider. With treatments, you can find ways to manage or even overcome your fears. That way you don't have to worry about what you might encounter the next time you go out your door. Oh gosh, guys. All right, that's some useful information. Okay, this is list of phobias. This is the one I told you I'm going to try my very best to pronounce, guys. It says a list of phobias, common phobias from A to Z. And this is on verywellmind.com list of phobias is what it says. A phobia is an anxiety disorder involving excessive and persistent fear of a situation or object. Exposure to the source of the fears trigger an immediate anxiety response. Phobias are one of the most common mental illnesses in the United States, according to the National Institute of Mental Health. This was dated for this year, guys. I don't know what the other one was dated, but this one was dated for this year. NIH, approximately 12.5% of adults in the U.S. will deal with specific phobia in their lifetime. Women are more likely to experience phobias than men. Typical symptoms of phobias can include nausea, trembling, rapid heartbeat, feelings of unreality, and being preoccupied with the fear object. Types of phobia. The American Psychiatric Association, APA, identifies 3 different categories of phobia. Social phobia is now known as social anxiety disorder. This phobia is marked by the fear of social situations in which a person might be judged or embarrassed Agoraphobia. This phobia involves an irrational and extreme fear of being in places, oh my goodness, where escape is difficult. It may involve a fear of crowded places or even of leaving one's home. Specific phobias, and when people talk about having a phobia of specific objects such as snakes, spiders, or needles, they are referring to a specific phobia. The four specific phobias categories. This is natural environment, astrophobia, hydrophobia, dendrophobia. Animals is batrachophobia, cynophobia, and quinophobia. Mutilation medical treatment is trypanophobia, dentophobia, and hemophobia. Situations is claustrophobia, aerophobia, and looks like glossophobia. My eyes are starting to act all crazy again, guys. While not comprehensive, the list of phobias offers a glimpse of many phobias that can have a serious impact on a person's life. As you may notice while you browse through this list, most specific phobias fall into one of the four major categories: fear of the natural environment, fear related to animals, fear related to medical treatment or issues, fear related to specific situations. One important thing to remember is that virtually any object can become a fear object. The names of specific phobias are often formed in nonce words or words coined for a single occasion only. These names themselves are often formed by taking a Greek prefix that represents a fear object and adding the phobia suffix. Because of this, any attempt to add a completely exhaustive list of phobias would be a fertile exercise. Any list of phobias could grow with the addition of newly coined terms for previous unnamed specific phobias. A through Z lists of some of the most common phobias. This article lists more than 100 of the most common phobias. It also covers some treatment options that are available. Click play to learn more about common phobias. Now let me know if y'all can hear that. Press 1 in chat if y'all can hear that.
Phobias, an irrational or excessive fear of an object or situation, are some of the most common mental health illnesses in the United States. In fact, the National Institute of Mental Health suggests that 12.5% of U.S. adults have some type of phobia. There are 3 different categories of phobias, as noted by the American Psychiatric Association, or APA. Social phobias, like interacting with unfamiliar people or starting conversations. Agoraphobia, fear of open spaces and crowds. And specific phobias, like fear of snakes or needles. It's important to remember that fears are specific to the person feeling them, and that virtually any object or location can induce fear. Some common specific phobias include arachnophobia, fear of spiders; ballonophobia, fear of pins and needles; claustrophobia, fear of confined spaces;
Thank you, Summer.
Coulrophobia, fear of clowns; dentophobia, fear of dentists; entomophobia, fear of insects; mysophobia, fear of dirt and germs; nosocomophobia, fear of hospitals; and nyctophobia, fear of the dark. Phobias can have a serious impact on well-being. But if you have a phobia, it's important to remember that you are not alone. Although phobias are common, they are also treatable. If you believe that you have symptoms of a type of phobia, start by talking with a mental health professional.
Okay, so I'm going to try my very best to read these off. I'm going to try to make it a bigger screen because I can barely see that. Can y'all read the screen? Because it looks very tiny to me, but my eyes are really acting crazy, like watering and burning and junk again. Can y'all see the screen? If not, I can make it bigger. Is that a little better? Okay, this is the A. and like I said, I'm going to try my best to pronounce it. Ablutophobia, fear of bathing. Acluphobia, fear of darkness. Acrophobia, fear of heights. Aerophobia, fear of flying. Aglophobia, fear of pain. Agoraphobia, fear of open spaces or crowds. Acmophobia, fear of needles or pointed objects. Amaxophobia, fear of riding in a car. Androphobia, fear of men. Anemophobia, fear of air. Anginophobia, fear of angina or choking. Angrophobia, fear of anger. Anthrophobia, fear of flowers. Anthropophobia, fear of people or in society. Phosphorophobia, fear of being touched. I'm probably not pronouncing these correctly, guys, but I am very trying. Arachnophobia, fear of peanut butter. Wow. Acrophobia, fear of spiders. Arithmophobia, fear of numbers. Astrophobia, fear of thunder and lightning. Astrophobia, fear of outer space. Axophobia, fear of disorder or untidiness. Atelophobia, fear of imperfection. Atchipophobia, fear of failure. Automatonophobia, fear of human-like figures. Autophobia, fear of being alone. Bees. Bacteriophobia, fear of bacteria. Barophobia, fear of gravity. Bathmophobia, fear of stairs or steep slopes. Batrachophobia, fear of amphibians. Bilinophobia, fear of pins and needles. Bibliophobia, fear of books. Botaniophobia, fear of plants. C is cacophobia, fear of ugliness. Catagelophobia, fear of being ridiculed. Hey, hippie grandma, good to see you, honey. Hope you're doing well. Catotrophobia, fear of mirrors. Cynophobia, fear of snow. Chromatophobia, fear of spending money. Chromophobia, fear of colors. Chronometrophobia, fear of clocks. Chronophobia, fear of time. Sibrophobia, fear of food. Claustrophobia, fear of confined spaces. Climatrophobia, fear of climbing. Coldrophobia, fear of clowns. Cyberphobia, fear of computers. Xenophobia, fear of dogs. D is Daimyonophobia, fear of demons. Decidophobia, fear of making decisions. Denotrophobia, fear of trees. Dentophobia, fear of dentist. Domatrophobia, fear of houses. Chiophobia, fear of accidents. Hey, Nana Butterfly. Hey, Becca. Good to see you, ladies. I hope you're doing well. E is ecophobia, fear of the home. Electrophobia, fear of cats. Or ailurophobia, I'm sorry, fear of cats. Emmetrophobia, fear of vomiting. Enotrophobia, fear of insects. Epiphobia, fear of teenagers. I can't pronounce that, guys, but I tried. Erotrophobia, fear of sex. Equinophobia, fear of horses. G is gamophobia, fear of marriage. Genophobia, fear of knees. Glossophobia, fears public and speaking in public. Genophobia, fear of women. H is hapiophobia, fear of touch. Helophobia, fear of the sun. Hemophobia, fear of blood. Her herpetophobia, fear of reptiles. I cannot pronounce this one, guys. I cannot pronounce this one. This one right here. I can't do it. I can't. Hippotomostro equipdalophobia. Have no idea, guys, but I tried. Hey, Beachy, good to see you, honey. Hope you're doing well. This is fear of long words. So if y'all can pronounce that, it's kind of like supercalifragilisticexpialidocious. If y'all can pronounce that big long word right there, yeah, more power to you, because I am trying, but it's just fear of long words. I've never heard of it, but y'all see it right. Y'all see it right there. Right there. Hey, Evie, good to see you, honey. Hope you're doing well. Hydrophobia is fear of water. Hypochondria. Well, there ain't no phobia in that one. Fear of illness. I is atrophobia, fear of doctors. Insectophobia, fear of insects. K is quinonophobia, fear of rooms. Kumonponophobia, fear of buttons. I have no idea. L is lycophobia, fear of color white. Lilophysophobia, fear of tornadoes and hurricanes. Locophobia, fear of childbirth. M is megalophobia, fear of cooking. Megalophobia, fear of large things. Melanophobia, fear of color black. Microphobia, fear of small things. Misophobia, fear of dirt and germs. Hey, Pink Fan, good to see you, honey. Hope you're doing well. Yeah, I can't pronounce it, guys. I tried. Hey, Mr. Michigan, good to see you. Mysophobia, fear of dirt and germs. N, necrophobia, fear of death or dead things. Noctiphobia, fear of the night. Nomophobia, fear of being without your mobile phone. Wow. Okay. Nosocophobia, fear of hospitals. Nyctophobia, fear of the dark. O is opsophobia, fear of gaining weight. Octophobia, fear of the figure 8. Amabrophobia, fear of the rain. And opidiophobia, fear of snakes. Ornithrophobia, fear of birds. Osmophobia, fear of smells. Otrasonophobia, fear of shellfish. P is paprophobia, fear of paper. Pathophobia, fear of disease. Pedophobia, fear of children. Philomathophobia, fear of kissing. Philophobia, fear of love. Phobophobia, fear of phobias. Photophobia, fear of feet. Porphyrophobia, fear of the color purple. Petridrophobia, fear of ferns. Petromyrhenophobia, fear of flying. Hydrophobia, fear of fire. Oh my goodness, there's a lot. There's a lot, guys. S is semhinophobia, fear of Halloween. Scolionophobia, fear of school. Scopophobia, fear of being stared at. selenophobia, fear of the moon, sociophobia, fear of social evaluation, somniophobia, fear of sleep. T is tachophobia, fear of speed, technophobia, fear of technology, thalassophobia, fear of the ocean, trichophobia, fear of hair, tonitrophobia, fear of thunder, trypanophobia, fear of needles, injections, trypophobia, fear of holes. V through Z is Venus tryphobia, fear of beautiful women. Verminophobia, fear of germs. Wiccaphobia, fear of witches and witchcraft. Xenophobia, fear of strangers or foreigners. Zoophobia, fear of animals. And Ziegler-phobia, fear of vacuum cleaners. Wow. Some of those I would never think, never think. Wow. Hold on, guys. I just closed down I got all excited. I've never heard of them before. Wow. You learn something new every day, guys. Okay, let me get back down. Okay. Recap. By listing all the phobias that may exist is not possible, it can be helpful to look through a list of some of the more commonly described phobias. As you can see by looking at this list, almost any object or situation can become the source of fear. Symptoms of phobia. Phobias lead to physical, emotional, and behavior symptoms. Common symptoms include chest tightening or pain, chills or hot flashes, choking sensations, confusion, difficulty breathing, dizziness, dry mouth, increased blood pressure, nausea, racing heartbeat, shaking or trembling, and sweating. Hey, Riff, good to see you, brother. Hope you're doing well. It says, in addition to these physical symptoms, people may experience dread, a sense of impending doom, fear of losing control, or even the feeling that death is immediate. To avoid such feelings, people with phobias may avoid any situation where they might potentially encounter the source of their fear. Causes of phobias. The exact causes of phobias are not known, but it is likely that a combination of factors plays a part. Some factors that increase the risk of developing a phobia include genetics. People with a close family member with a phobia or another anxiety disorder also have a greater risk of phobia. It is important to note, however, that people who don't have family members with the condition still develop phobias. Traumatic experiences. A difficult, stressful, or traumatic experience can also trigger the onset of phobia. For example, being bitten by a dog as a child might trigger a fear of dogs in adulthood. Common versus rare phobias. Some phobias are more common while others are often quite rare. 5 of the most common phobias include acrophobia, the fear of spiders, ophidiophobia, fear of snakes, glossophobia, fear of public speaking, acrophobia, fear of heights, and social phobia, the fear of social interactions. The fear of public speaking is also common, that some researchers have estimated as much as 77% of people have some level of this fear. Rare phobias may be novel terms coined to identify a single unique case of fear that occur quite infrequently. Some different rare specific phobias include spectrophobia, the fear of mirrors, and clicophobia, the fear of chewing gum. And that big old humongous long word that I can't even try. I mean, I'll try, but I don't think I can get it, guys, but I can try. Hippopotamostrosicquipedaliophobia. Yes, I tried. That big old long word, I tried. The fear of long words. Treatment for phobias. While phobias can be distressing and create disruptions in your life, they are treatable. Some different treatment options include therapy and medication. Exposure therapy. Exposure-based treatments are the first approach in a treatment of phobias. In this type of treatment, you're gradually and progressively exposed to what you fear. You might start by just thinking about your phobia trigger and then move slowly towards looking at images of the object and finally being near the object in real life. Types of exposure-based treatments that may be used include In vivo exposure. This involves being exposed to a source of your fear in real life. Virtual exposure. This involves the use of virtual reality to practice gradual exposure. Systematic desensitization. This involves being gradually exposed until you become desensitized to the source of your fear. During this process, you'll also practice relaxation techniques to help calm your body when your fear response kicks in. Cognitive behavior therapy, often referred to as CBT, congenital behavior therapy, involves learning to identify the underlying negative thoughts that contribute to the feelings of fear. Once you become better at noticing these thoughts, you can then work on replacing them with more positive, helpful thoughts. Eye movement desensitization and reprocessing, which is EMDR. Utilizes rhythmic eye movements to help people process and recover from traumatic experiences. It is frequently used in the treatment of PTSD, but also can be effective in treatment of a variety of other mental health conditions, including phobias. Medications may be prescribed in some cases to help manage some of the symptoms you might be experiencing as a result of your phobia. Medications your doctor might prescribe include selective serotonin reuptake inhibitors, or SSRS, beta blockers, and anti-anxiety drugs. A word from Very Well: phobias can have a serious impact on well-being. It's important to remember that you are not alone. Phobias are common and treatable. If you believe that you have symptoms of some type of phobia, consult a doctor for further evaluation and treatment advice. Well, of course we would notice you, Sharon. I hope you're doing well, darling. Of course we would notice you, girl. We love you. All right. This says, oh my goodness, hold on a minute. This says specific phobias. Oh my goodness gracious, my eyes giving me a fit. Oh Lord. All right, it says overview. Specific phobias are extreme fear of objects or situations that pose little or no danger but make you highly anxious. So you try to stay away from these things. Unlike the brief anxiety you may feel when giving a speech or taking a test, specific phobias are long lasting. Without treatment, specific phobias tend to last a lifetime. Phobias can cause strong physical, mental, and emotional responses. They can also affect how you act at work or at school in social situations. Specific phobias are common anxiety disorders overall. They happen more often in females. Not all phobias need to be treated, but if a specific phobia affects your daily life, several types of therapies are available to help you work through and conquer your fears, often forever. Symptoms. A specific phobia involves a strong, lasting fear of certain object or situation that's much greater than the actual risk. There are many types of phobias. It's common to have a specific phobia about more than one object or situation. Specific phobias also can happen along with other types of anxiety disorders. Common types of specific phobias and fears are situations such as airplanes, driving in closed spaces, or going to school. Nature, such as thunderstorms, heights, or the dark. Animal or insects, such as dogs, snakes, or spiders. Blood, shots, or injuries, such as needles, accidents, or medical procedures. Others, such as choking, throwing up, loud noises, or clowns. Each specific phobia has a name. Phobia comes from the Greek word phobos, which means fear. Examples of more common names include agoraphobia for the fear of heights and claustrophobia for the fear of confined spaces. No matter what specific phobia you have, you may feel intense fear, anxiety, and panic right away when exposed to or even think about what causes you fear. Know that your fears are not reasonable or not as big as you think they are, but you cannot control them. Having anxiety that gets worse as the situation or object gets closer to you physically or in time. Do everything possible, stay away from an object or situation, or face it with extreme anxiety and fear. Have trouble with daily activities because of your fear. Have physical reactions and feelings, including sweating, rapid heartbeat, tight chest, or trouble breathing. Feel like you're going to throw up, or you get dizzy or faint, especially around blood or injuries. Children may have tantrums, or they may cling, cry to refuse to leave a parent's side, or approach their fear. It says when to see a doctor. An extreme fear can make life hard. For example, taking long flights of stairs instead of the elevator. But it's not a specific phobia unless it seriously disrupts your life. If anxiety negatively affects the way you act at work or school or in social situations, talk with your doctor or another healthcare professional or a mental health professional. Childhood fears such as fear of the dark, monsters, or being left alone are common. Most children outgrow them, but if your child has an ongoing strong fear that interferes with how they act at school or work daily, talk to your child's doctor. The right therapy can help most people, and the sooner you ask for help, the more likely that therapy will be effective. Hold on a minute, guys. Let me get a sip of my tea. Thank you guys so much for being in here. If y'all haven't hit that like, please hit that like. If y'all haven't hit that subscribe, please hit that subscribe and set the notifications to all. Thank you guys so much. Causes. Much is still not known about what causes specific phobias. Causes may include bad experiences. Many phobias start because of bad experiences or panic attack related to a specific object or situation. Sometimes even seeing or hearing about a bad experience can be enough to trigger a phobia. Genetics or learned behavior. There might be a link between your specific phobia and the phobia or anxiety of your parents. This could be due to a blend of genetics and learned behaviors. Brain function and structure. Those with specific phobias trigger certain parts of the brain, while a person without these phobias does not have the same response in the brain. Also, a person with a specific phobia can have a different brain structure than a person without that specific phobia. This is the risk factors. These factors may increase your risk of specific phobias. Age. Specific phobias can first appear when you're a child, typically by age 10, but they can occur later in life too. Your relatives. If a family member has a specific phobia or anxiety, you're more likely to develop it too. This could be something passed down to you from a blood relative. Or children may learn specific phobias by watching how a family member reacts to an object or a situation. Your temperament. Your risk may increase if you're more sensitive to anxiety, or you're more reserved or negative than what's typical. A bad experience, a specific phobia, can start when something distressing happens to you, such as being trapped in an elevator or attacked by an animal. Learning about bad experiences, hearing about bad experiences, such as a plane crash, can cause a specific phobia to start. Changing your behavior. Avoidance is the most common way people cope with phobias. By doing so, their anxiety typically gets worse. This is complications, guys. Although specific phobias may seem silly to others, they can be distressing and damaging to people who have them. These phobias can cause problems that affect many areas of life. They can result in social isolation. Staying away from places and things that are feared can cause problems at work or school or in connection with others. Children with these disorders are at risk of problems at school and loneliness. They may have trouble in social situations if their behaviors are very different from their peers. Mood disorders. Many people with specific phobias have depression and other anxiety disorders. Substance misuse. The stress of living with a severe specific phobia may lead to misuse of drugs or alcohol. Unaliving yourself. Some people with specific phobias may be at risk of unaliving themselves. Strain on loved ones. To try to keep from feeling anxious, people often rely too much on being reassured by others. Sometimes this leads to others becoming too protective over the person. With anxiety, for example, a parent may become too protective over a child, resulting in more stress for the parent. And that's all for that one, guys. And then I have one more. This one is phobias. Find information on phobias, including symptoms, causes, and how to accept treatment and support. Get tips for helping yourself, plus guidance for friends and family. How to help someone with a phobia. I thought this was really good information. If you have a friend or a family member or a coworker or something like that suffers with a phobia and you don't quite understand it, well, this is good, useful information that might be able to help you understand a little bit better, or better to be supportive of them, if that makes sense. This section is for friends and family who want tips to support someone who has a phobia. It says, try to understand phobias. Find out as much as you can about the phobias. Doing this will help you understand what someone might be experiencing. Our information on phobia is a good place to start. Reading personal experiences from Mind Blog can help too. Try to learn about their experience of living with phobia. You could ask them how their phobia affects their life, or what can make it better or worse. Listening to their experience might help you empathize with how they feel. Take their phobia seriously. It might feel hard to understand why someone has a phobia of a certain situation or object, especially when their phobia seems irrational. However, it's important that you take their phobia seriously. Try to understand that their phobia can cause severe anxiety, cause panic and distress, affect their daily life. You may not be able to see why they are afraid of something, but the anxiety and fear they feel is very real. I'll never complain because I see no point in doing so, but I get very tired of being politely mocked for my fear. Don't put pressure on them. Avoiding a situation can make a phobia worse over time, but it can also be very distressing if someone is forced into situations they're not ready to face. It's important to be patient with them. You should work at this pace that suits them. Try not to pressure your friend or family member to do more than they feel comfortable with. Don't try to force them to be in a situation that triggers their phobia. My mother always brings up a discussion about me facing my phobia and maybe getting treatment for it. But for me, right now, I don't want to face it. I feel I am not ready, and I don't feel it is impacting my life enough that it needs to be faced. Find out what helps them. Ask your friend or family member what you can do to help. For example, it might help to take them out of the situation. Talk to them calmly. Do breathing exercises with them. This might help them feel safer and calmer when they start to feel frightened or panicked. Knowing that you are around and know what you to do can feel reassuring. I feel better if I have someone with me who knows about my anxiety and how to calm me down. It helps if I just focus on that person talking. Support them in seeking help. If you think their phobia is becoming a problem for them, encourage them to seek treatment. Suggest to help arrange a doctor's appointment. If they're unable to leave the house, try to find out if their GP does home, online, or phone visits. See our pages on seeking help for mental health problem for more information. Offer support when they attend appointments. You could offer to come along to their appointments and wait in the waiting room. It can sometimes help just to have someone accompany them, like a support system. You can also help them plan what they'd like to talk about with their doctor. Our resource, Find Their Words, often offers tips on talking to your GP about your mental health. Encourage them to seek help from a therapist. You can help them research different options. See our page on how to find a therapist. Help them look into different options for support. Try finding out about community services, peer support groups, or your local mind. To find your local mind, you can use an interactive map of local minds. For more information, see our useful contacts for phobias. Like I said, this is on mind.org.uk, and then like information about phobias. Remember to look after yourself. It can feel challenging to support someone with a mental health problem. You're not alone if you feel overwhelmed at times. It's important to try to look after your own mental health. If not, it can feel hard to find the energy and time you need to be able to help someone else. Set boundaries and don't take on too much. If you become unwell, you won't be able to offer as much support. Decide what your limits are and how much you're able to help. See our pages on how to manage stress for more information. Show your caring role with others if you can. It's often easier to support someone if you're not doing it alone. Reach out to the other friends and family. The person is comfortable with you doing so. Talk to others about how you feel. Talking about your feelings with someone you trust can help you feel supported too. Try to be careful about how much you share about the person you're supporting. It says, for more ideas, see our pages on how to cope with supporting someone else. This information gives practical suggestions on what you can do and where to find support. All right, guys, so that was all the information I had for tonight. That was quite a bit. My eyes are like actually starting to act all crazy. I'm going to have to put me another. It's this one, guys. It's giving me a pain in the rear again. So I had to close my camera off because I was wiping my eye. Okay, guys. Well, my phobias, and like I am petrified. This is a massive phobia that really, really, really gets my anxiety pumping, if that makes sense. I am scared. I am petrified of clowns and spiders, and I have been that way ever since I can remember. And I don't like snakes. So mine, and I'm afraid of heights. But so my phobias are yeah, I'm okay, honey. My eyes just giving me a fit. I think it might be allergies or something. I don't know. I'm having a hard time fully seeing, if that makes sense. I might actually have to go to the eye doctor. I'm having a hard time. Um, we haven't yet, Mr. Michigan, but it's kind of like a fog. I don't know. Like I said, I might have to go. I don't know. It's like burning, but it's kind of like when I look at something, it's kind of like a kind of like you got kind of like a fog over your eyes or something. I don't know. It's very weird. It's dry. It's itching, and then when I look at something, it's like I got a fog type thing or a film or something over my eye. I'm not really for sure. I don't know. But yeah, I'm petrified of clowns. Yeah, I'm petrified of clowns. I've been ever since I can remember. And y'all might think I might sound crazy, but I have a really, 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 and I strongly believe this. You believe what you want to believe. It's up to you. Whatever. I hope it is too. I hope it is too, because I have to wear glasses all the time. I can't fully see. Like, it's very, very blurry. I have to wear glasses 24/7. I have to wake up with glasses on and go to sleep, take my glasses off. Like, I have to wear them all the time to drive and everything. But oh gosh, I'm telling you. Um, but I am petrified of clowns. I am petrified of spiders. I'm scared of heights. Um, and like, okay, like I'll watch certain scary movies, but I like the scary movies that are like Saw and Hostel and stuff like that. It's kind of like gory but not really scary. It's more like the edge of your seat type stuff. I like those kind of scary movies. But I'm scared of ghosts. I don't know if that's a phobia, but I'm just telling you guys. I'm scared of ghosts, and I am absolutely 100% a huge phobia. I didn't even cover this. And I don't know if you guys believe this or not. Like I said, it's my opinion. It's my opinion, guys. Yes, please. Okay, honey. Thank you for letting me know, Rebelicious. I hope that she's safe. I hope that she's safe, because I knew that she was driving home. Mine is like I said, I do not know if y'all believe in this, but I strongly do. So, I mean, everybody's entitled to their own opinion. Please do not laugh at me, because most people do when I say this. But I have a massive, I mean, it's pretty up there with the clowns and the spiders, of possession. I'm scared. I'm petrified of people being possessed. And I don't know if that falls underneath the witchcraft or Wiccan. I don't think it does. I don't think it does. But it really, 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 really scares me. A friend of mine, and I think these things are very evil. And no offense to people that like them. I'm just saying, this is my opinion, guys. So I mean, y'all, to each their own. I'm just saying, a friend of mine, they decided they did not know what they were doing and got on one of them evil boards. I won't say the name, but got on one of them evil boards, and bad things happened. And real bad things happened. So I strongly, strongly, strongly believe in possession. But like I said, it's my opinion, guys. Everybody's entitled to their own opinion. They say that possession is based on a true story from those movies, like Possession of whatever it is. Y'all know what I'm talking about. But like I'm telling you guys, like I am petrified. I am like absolutely like. I just think they're just my opinion. I think they're evil, but like I said, that's just me. I don't want to offend nobody. If people like them, I mean, that's on y'all. But just please don't like. I get freaked out because I know certain things can happen, and it's just very, very creepy for me. Very creepy for me. It just gets my anxiety kind of racing talking about it, because my friend at that time did not know what they were doing. And I said, don't mess with that. That thing is evil. I'm telling you. It was an older one. Let's put it that way. And they started speaking in tongues and like crawling the walls. And it was very creepy. And my ex at the time, she had a necklace with Jesus on it, a cross, Jesus on the cross. Well, we was praying for him and reading scriptures out of the Bible. Like I said, I'm not getting religious. I'm just trying to tell y'all my point of view on that subject. We was reading scriptures out of the Bible, and they started hissing and cussing, and it was just freaky. Like it was freaky. So to this day, I haven't seen them in years, but to this day, they still have the crucifix on their forehead right here. It was it was embedded into their forehead when we put the cross on the. Well, I mean, I did, but my ex-girlfriend, she put the cross on his forehead, and I think I was like 18, so it was a long time ago. But it still messes with me. But she put the cross on his forehead, and she started reading scriptures out of the Bible. Well, I didn't know what to do. I've never dealt with that before. It freaked me out. It freaked me out, guys, honestly. And so I called a mental health line. I didn't know what to do, and they laughed at me. So that's what I'm saying. Everybody's entitled to their own opinion, but I strongly, strongly believe in that. That's just my opinion. So that's one thing I am also scared of, is people being possession. Like I will not watch any, you can ask Rebel this, I will not watch any movie whatsoever that has any kind of possession in it, even if it's not a scary movie. If we're sitting there watching it and it has like something to do with possession in it, I won't watch it. It'll freak me out. Like I have a hard time breathing. Like it freaks me out. And so like, I'm just saying, I'm just, like I said, everybody is entitled to their own opinion. So I don't want to, to push y'all away from what I'm saying, because this is just me. Y'all believe what you want to. I'm just saying, some people like that stuff. Some people don't like that stuff. Some people know it's evil, and some people think it's cool. Whatever. But that's just me. That's just my personal opinion. It's just my personal opinion that about the possession thing, and the evil board is what I call it. So, but that's just a few of my fears. I've never heard of some of those fears I went over, especially that long word that one's like this long, I hope that's what it is. But why in the world would I feel like I have a film over my eye? Like, I don't know. It's weird. It's strange. Stupid people make me possessed all the time. I'll start speaking in cursive. Beachy said, being a clown myself, I have a fear of people who are afraid of clowns. Well, thanks, Beachy. I love you too. I can't help it. It's not my fault. No offense, Beachy. I love you. God almighty. And it feels like, my glasses are dirty, which I've wiped them off 700 times. They're not dirty, but it feels like they are because feel like I have something on my eye. You know what I mean? Oh, gosh. I suppose that everybody's entitled to their own opinion. I'm not going to dock anybody. I mean, I'm not going to, not dock. You know what I'm saying? I'm not going to look down on somebody because they like that. I'm just saying, that's my personal opinion. It's just me. Like, I feel that they are evil. That's just my opinion. I'm just saying. I've had sleep, guys. I mean, like, I don't get a buttload of sleep, but I have sleep. I don't know. This has been going on for a couple days. I don't know. I really don't know. That can get kind of weird. Destroy all parts of any board before 2010-ish. Pete Finn said there's so much more than evil in this world. Too much we hear about daily, sadly. That's so true. That's what I was saying. If we could just be the good in the world. Today was kind of like more of an awareness time, and just bringing awareness for the phobias. And some of them I've never heard of. So it's kind of like, you're learning something new every day too. Hey, Mary Jane, good to see you, love. Hope you're doing well. Hello, Miss Shani B. Good to see you, honey. Hope you're doing good. Hope your daddy's doing good and healing. You'll have to message me and let me know how he's doing, honey. Because I know I constantly ask about him, and I try to remember everybody's situation if I can. I don't know. I think the cross on her forehead was to ward off evil. Sounds like she had excessive fear. I'm telling you, I don't know, but I mean, like, it was embedded. I seen them probably a couple years ago, we'll say, and they still had right here on the forehead right here. And I'm like, wow. I don't know. It freaked me out because they didn't have it on there before. Freaked me out. Film over the eyes as the dust or pollen coming out and it gums up. Mine do it all the time. And it's that way right now. I'm telling you guys. I fear evil people too. You're supposed to. Yeah. What's up, Ghost Devil? Good to see you, brother. Hope you're doing well. Yeah, I mean, I'm just telling you, that's my fears, guys. Like, everybody's entitled to their own fears and phobias and all that. Oh my goodness. Like, there's sometimes they feel like sandpaper. There's sometimes they feel like I feel them over. It's like a mixture. Smoke or soap in your eyes, maybe some saline solution to clear it up. She carved it in her forehead. I'm telling you, I don't know. I really don't know. I don't know, because I was reading scriptures out of the Bible. It freaked me out. I sit in the corner and held a Bible and a cross in my hand. I was like, don't you dare come in near me. And when he, it was a friend of mine, and he was a drag queen. Anyway, when he came near me and I had the, Bible in my hand and the cross in my hand, and I was just praying because I was like, I'm freaking out. I can't even deal with this. I'm freaking out. I don't know what to do. I've never had to deal with this before. I've never seen one of them boards other than then. I was raised up very sheltered, guys, seriously. So I didn't really know what it was, but I heard that it was bad and that nobody didn't really need to play with it because you would really make them mad, So he didn't close it up correctly or something to that effect. And it got mad and took it out on him, and then he tried to take it out on everybody else. So I just like it. It's very freaky. What's up, Rebel? Nana Butterfly says, as someone who's losing their eyesight, please get your eyes checked. You don't want to mess around with your vision. I definitely will, honey. If it doesn't go away, it's just aggravating. Like, it's just aggravating. I don't know. And I'm a diabetic, which I try to keep my numbers under control, and I'm on medicine. I just don't know. I don't know what's going on. It's weird. I don't know, guys. Don't have any fears, only for my girls and G baby's future. The way this world is. Oh yeah, that's true too. That's exactly right. Don't play with you don't know. Are you safe, Rocket Queen, honey? Yeah. Rebelicious told us that. Um, Rebelicious told us that she was covering some, or going across some bad storms and had some internet issues. Are you safe, honey? And earlier I was eating dinner at the table behind me, and James was looking at me, and I felt like, okay, we don't have a ceiling fan. We don't have a ceiling fan, but I could see out of the corner of my eyes, like right in here, not where my glasses are, right here, like right in here. It looked like a ceiling fan at the top of the, like beside me, the ceiling fan. I was like, what? I was looking around. I was like, what in the world? It was like like, you see when you have a ceiling fan, you can see like the shadows. It was like it was right here, and I kept on looking outside of my eyes, inside of my eyes. I was like, what in the world? It was kind of like just like constant, like, I don't know. I guess it was black spots. I don't know what you call it. I don't know what you call it. It freaked me out because I even took my glasses off and it was still doing it. It was like something like a ceiling fan, like the shadow of a ceiling fan, like right here in the the sides, right here, right in here. And I was like, what in the world? Very weird. It was very weird. I was like, I've never had that before. And they also, that my eye doctor said that I have dry eyes anyway, if that makes any sense. Exactly. Exactly, Shani B. I mean, I'm just saying everybody's entitled to their own opinion. I personally don't like them. I personally don't, they freak me out. You can ask Rebels in chat. Babe, do I watch any movies that have possession in them? And if by chance they come across anything possessed, do I watch them? He'll tell you. Like, it freaks me out, guys. I'm telling you. I'm telling you. Mm-mm. Like I said, that's my opinion. Everybody, like, I talk about it and I'm like, I strongly believe in that. I'm telling you guys. And people are like, well, you're crazy. I don't believe in that. And I'm like, well, that's your belief. This is mine. I actually had, a friend, and it happened. It, it was hard to explain, but they was messing around with that board. So, typically when you mess around with them boards and you don't know what you're doing, or don't close it out, or however that junk works, I don't know. I don't know nothing about it. Don't really want, I feel we're talking about it. I'm just saying, however that works, if you just screw with it, then you piss them off. I'm just saying. And he made him mad. So I'm like, no, no. Yeah, that's what I was talking about. The exorcism, like the exorcism of Emily Rose and all that stuff. And those are based on a true story from them boards. Nope, I'm good. I'm good. Just stay away from me. I'm good. That's one of my a big, huge phobia, fear, or whatever, other than clowns and spiders and heights. Mm-mm. Oh no, we're not talking about them. Why in the world did you even type it? I just said the evil boards. You could have said the evil board. Daggone it. Rebel dancing in a thong is scarier than the exorcist. Oh, Mr. Michigan and Rebel. I'm telling you. And then, I just don't like, I'm knock on wood. I haven't never, not that I know of, come across the ghost, but I don't really like ghost movies. No. I'm more of the like, I mean, I love my movies. Don't get me wrong. Yeah, I did read it and I don't want to read it. I don't like that word. He said, okay, I'm out of here. I don't like J boards. I don't like to say the word. They're creepy. See what I mean? See, I'm just saying, everybody believes in their own thing. I'm just saying that's just me. And then a butterfly, see what you're talking about. It's creepy. Above that comment. Okay, well, I'm going to look and give me a minute. This chat's going crazy. Hold on. He said nope, that I don't watch them. Okay, I see nope. That was me dancing in a thong for you, babe. Okay, how you doing? Those who shall not be named. Exactly. Absolutely. They're evil. I'm telling you. We don't want no evil and negativity, guys. I'm just saying that's one thing. I'm just telling you guys what my phobias are, and that is one of them. Other than clowns, no offense, Beachy, I love you. Other than clowns and spiders, I'm petrified of both of them. You can ask Rebel. I like roll in a corner and cry and freak out like it's bad. It's bad. And heights, because I'm short. So I mean, I'm only 5'4.5" or 5'5.5", something like that. So I'm short. So like, I'm just like, if I'm really high, I have to step on a ladder to get in my cabinets in my kitchen, and I have a hard time standing that high and looking down. Like I can't. Nope. 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 But yeah, I just thought that this would be good to bring awareness to. And some of these I have never even heard of. Like, I mean, no offense if people are afraid of them. I'm just saying, like the fear of peanut butter. I know people are allergic to peanut butter, but I've never heard of a phobia of peanut butter. Even in bed, she is short. My arm was over her head last night as she was dozing off. Yep, that's true. He does it to me all the time, guys. Wait till y'all go. Y'all see more of us on the tattooed couple um, stream. He'll put his arm on top of my head. Yeah, because he's like 6 foot or close to 6 foot, and I'm 5'4.5", and I count that half or 5'5". One in between them two. I don't know. Exactly, guys. I'm telling you. Like I said, no offense to people that like them. That's each their own. But I'm just saying, my personal opinion. Nah. Yeah, he always gives me a hard time being short. Rebel, he doesn't seem like he has a phobia of anything. I swear he don't. He doesn't seem like he's scared of anything, or fear, or whatever. Do y'all have any phobias? Has anybody got any phobias? He said, "Hey, Ghost, I sent you a message on Discord." Good night, Demetrius. Tomorrow night is our open panel, Demetrius, and I know you've been wanting to come up. Tomorrow night is our open panel. Rebel's having an open panel on his, and then I'm having my open panel on mine after his. So it's going to be two open panels, one on Rebels, and they're going to talk about true crime or whatever. And then here we're just going to have a good time and just hang out and think positive thoughts and just have fun like we normally do. Shouldn't you be scared of snakes? My biggest fear are at the bottom of your legs. Oh, you have a fear of feet? That's not a phobia. That's a babe, that's not a phobia. That's a what is it? What are they called? What are they called? Dang it. Oh gosh. What are they called? Ah. No, not wild. Superstition. That's what those are called. Superstitions, babe. They're not called phobias. I have a fear of brooms touching my feet. Yes, superstition. That's not a phobia, babe. No, phobia is real. You have a foot fetish, Mr. Michigan? Oh, Lord, guys. Yeah, Rebel is pretty superstitious, whatever that word's called. He is. Don't walk over, don't touch his feet with a broom. Don't walk underneath a ladder. Let's see, what else are they, babe? Gosh. I can't think. There's a few of them. Oh, so you really, really don't like feet, Mr. Michigan. Don't step on a crack or you break your mama's back. Don't split poles. Oh, yes. If you split poles, you have to say, or we say buttermilk, because we don't want no bad luck. My phobia is a bait used for fishing and you dig them up. I can't say or type the word. I know what you're talking about. You're not talking about corn that you get out of the can. You're talking about other things. Hippie grandma. Because O.J. Simpson was evil. I told my sister to leave that evil book in her car. I wouldn't let her bring inside my house. I was serious. Damn monkey toes picking up stuff from the floor makes my stomach curl. X out of a windshield. Oh, yeah. Yeah, I knew about that one. X out of a windshield. If a solid black cat crosses the road. I don't think we have any New Year's ones. Nana Butterfly said, I've had experiences with spirits, but haven't actually seen one. We have one living in our house now. I haven't seen her. But my son's ex-girlfriend did a couple times. Well, I'm just... It sucks because, and I'm not trying to bring it. I mean, I'm just one of those weird people. I'm just me. Like I told you guys, I'm just me, like it's interesting. Don't get me wrong about the ghost or whatever, but like, it just kind of freaks me out, I mean, like, as I always say, like, if you move into a new place, if by chance there is any, be good to me. I'll be good to you. We get along just good. You know what I mean? Like, I'm scared of cranes. I can't look up at them. I get vertigo and freak out. Yeah, because they're really, it's kind of like you're afraid of heights, Rocket Queen, because they're so high. You know what I mean? I've lived in 2 houses with spirits. I saw one. Nope, I'm good. Nope, I'm good. I have crosses and of course Bibles and stuff that just try to keep good vibes going. Good vibes going. That's what I need. Good vibes going. Yeah, I'm scared to death of heights too, Rocket Queen. And I think you're short like me, ain't you, honey? Yeah, I might be a little bit taller than you. I sleep with Satan herself every night. I fear nothing. Oh my goodness, Mr. Michigan. Oh Lord. Peachy said, I just wait for another black cat to go in opposite direction to uncross me. Okay, I'm the same height that you. I'm like 5'4" or 5'4.5", maybe 5'5". So I'm like in between. Like I'm about the same height. I'm about the same height that you. Give or take maybe half inch, if that. I saw a guy one time standing on a hill and it turned for a second and looked back, and he was floating ball of flames coming up towards us. And it was broad daylight. It was on Skull Hill in Bristol where my dad lived. Pat says, I think some fear is healthy thing. I mean, really. Yeah, he's told me about that store, and I'm like, yeah, I'm good. That's freaky. I'm more on the 5'3" side, though. That's okay, Rocket Queen. See, we as short people got to stick together. Well, Rebelicious, I'm right there with you, sister. It sucks being short. You always got to get on like step ladders and junk. And Hippie Grandma, she's about the same height as me, give or take. I think I may be just a little bit taller than her, not much. Hippie Grandma's 5'3". She's skinnier than I am, babe. He said, so you and Rocket are the same size. You can fit in a suitcase just like her. Nope. I'm too big. I'm a big girl. Mr. Michigan said 5'11", standing up and laying down. I'm 6 foot. Beachy said, Ghost Rider Rebel. I can smuggle you to Australia. Rocket Queen and me and Rocket Queen, we would never have a dull moment. We would never have a dull moment. You can smuggle me to Australia, but then it'd be a long time before I come back home, and you'd be like, do something with these kids. Beachy, you're 5'11"? You don't even look that tall, girl. Wow. Pat says, fear of bugs and snakes and such. A lot of them are deadly and poisonous. Mr. Michigan says, my belly is 6 foot. He said, oh, hell no. They're going to wake you. Well, how in the hell are we going to put all these youngins and me with all the voluptuous stuff that the good Lord blessed me with in a suitcase and ship me to Australia with Rocket? We'd be having a party, Rocket. Woo woo, yeah. He said, oh, hell no. Oh, Lord. Mr. Mrs., you crack me up. Hippie Grandma said, party down under. Woo woo. Super glue 2 or 3 suitcases. Yeah, that's just for me. That's just for me, babe. Mr. Michigan said, you 3 together? Nope, I'm out. Laughed my ass off. Oh, Lord. Yes, and don't forget Digger Duck. Absolutely. Or duct tape them together. Yes, we love us Mama Digger. That's what I nicknamed her. We love her because she's like a mama hen to everybody. We love her. You're funny, I'm telling you. Oh my goodness gracious! You got Rocket Queen all excited, thinking you was gonna. She was gonna. You was gonna ship me to Australia. I'd probably get made fun of there because of my southern accent. They'd be like, "What did you say?" I'd have to stay close to Rocket Queen because people would be like, where in the hell is she from? Like, Rocket Queen, these damn idiots, they making fun of me. I'm going to have to hide behind you, girl. Or hide behind you and Casper. If duct tape had fixed it, nothing will. I was going to say Digger Duck would be there to calm y'all down, but then again, she would probably be the life of the party. Absolutely. Yes. Oh, Beachy said, no, sorry, I'm a shorty, 5'2". I meant afraid of heights above 5'11". Oh, okay, because I was like, damn, girl, you don't look 5'11". Rebel said, oh, hell, I can't go then because they would never understand me or Casper, especially Casper. Rocket said, no, Aussies are chill. They just say, have another beer, mate. Nana Butterfly says, I have a fear of losing my parents, husband, children, grandchildren. I already lost one granddaughter when she was 6 weeks old. Oh, I'm so sorry, darling. I hate to hear that. I think a lot of people have that fear too, fear of losing, people close to you. Pat Gaines says, clowns are only scary if they got big teeth. Toothless ones are harmless. Really? Mine, I'm telling you, I'm just really petrified of them. Oh my gosh. I'm telling you. I really don't want to go to the stinking eye doctor with this. Don't clean up. I'm like, hey, fix this junk. I don't know what it is. Fix it. Yes, definitely prayers, Nana, honey. I hate to hear that, darling. Make sure you guys hit that like button if y'all haven't done so already. Thank you guys for coming in here, chilling with me. Now we're just kind of, just shooting the breeze, I guess you could say. Rebel said, then we had that clown scare going around the country, and that really, absolutely, I'm telling you guys, that freaked me out. I made him, like I was saying, you're welcome, Nana Butterfly. Like I was telling you guys earlier, I think it was last week or something. It recently, but anyway, we at our old house when we lived on the Tennessee side. I had the laundry room was in the back porch, but it was closed off and it had windows. Well, when that clown scare came around, and they was creeping people out, just standing there looking at people. I mean, it was just freaky. I made Rebel. You're going to cover every one of them windows because I had to go out there and do laundry. And, I would go down out there at night. I mean, it was closed in and it was attached to our back door. Our back door going into our kitchen. But it still freaked me out because, like, behind us was we had a big old hill going up our house. There was nobody behind us. A big old hill. And as soon as you go to the top of the hill was a water tower. So it freaked me out. So I made him cover every one of them windows. It was like 12 windows on my back porch. Made him cover every one of those windows so I could do my laundry. And I still got the heebity-jeebities, as in if I open up one of them curtains, they'd be standing right there. No, I'm good. No, I'm good. Hey, Kristen, good to see you, honey. Much love to you, darling. Yes, we love you, honey, and we're praying for you, and we hope you're okay, sweetheart. Mr. Michigan says, all they are just goofy guys with honking noses. They are harmless until you offer them candy. Nope, not me. Nope. My brother's the same way. He sees a clown. He says, "You better back up and get the hell." You can ask Rebel this, and my brother he preaches, and he's like, "You better back up and get the hell away from me." Yeah. So I mean, yeah, but they said that a lot of these phobias and fears could possibly come from blood relations. So my brother's petrified of them. I'm petrified of them. And he's my oldest brother. Like, I'm the baby and the only girl, and he's my oldest brother. I have 3 older brothers, but my oldest brother is the one that absolutely cannot. He's not. He's scared of clowns too, like I am. Yeah. No offense, Beachy. I'm just saying. I'm so sorry, Kristen, honey. I'm so sorry, sweetheart. I love you. I've been praying ever since I seen that picture on Facebook. I'm hoping, that he figures out where home is and maybe he just flew away and came back or something. I don't know. Hopefully he'll figure out where his home is because he was a beautiful angel. And I'm so sorry, darling. Pat says those dummies at ventriloquist have kind of given me the heebies. Kind of creepy. Beachy said, you say candy? You did? Where? Beachy wants some candy. Beach, you want some candy, guys? But yeah, I just, like I said, I just think that, and that's also being kind of true to yourself as well. If you're afraid of things, there's support out there. There's people that will help you. You're not alone. There's a lot of people that suffer with phobias and fears and heights and clowns and spiders and whatever there's a lot of people that have specific phobias. There's a lot of people that are scared of certain things or fear, have really bad anxiety or panic attacks over certain things. I just want you guys to know that you're not alone. Definitely, that's part of you, but there's ways to go around and try to get better. I know that's easier said than done, trust me, but it's to try to get better and not let it control your life, because certain phobias and fears can control your life, and then you don't even want to get out of your house or speak to anybody or nothing. So you don't want that to do that, because you want to be able to be yourself and have a support system and stuff like that. So I think it's very important, if by chance anybody does suffer with a phobia and it's affected their daily life, like anxiety or panic or shakes or chest problems, chest pain or anything like that, please see a doctor. I don't give out medical advice because I'm not a doctor, but I'm just saying, please see a doctor so they can determine how to help you. Hey, Truth Seeker, good to see you, honey. Hope you're doing well. Hope you have a great night too, Mr. Michigan. Thank you so much for coming in here and chilling with us for a little bit. Thank you, Hippie Grandma. Well, we lost one, but it'll be all right. We'll gain it back. It'll be okay. 566 subs, guys. We did have 567, but unfortunately, sometimes it happens. But I just appreciate every one of you guys coming in here and supporting me. Like, I say the same thing that Rebel says. I cannot do this without you guys. Y'all are what makes us do what we do. So y'all are definitely appreciated and loved more than y'all know. Seriously, I cannot do this without you guys. It means so much to me that y'all come in here. Make sure y'all hit that like if y'all haven't done so. Nana Butterfly says, since I've been losing my vision, I can't work or drive, so I'm pretty much alone and don't get out. So when I do go out, now I have major anxiety or panic attacks. I'm so sorry, Nana Butterfly. Honey, I'm here for you if you need somebody to talk to, darling. I hate that, darling. Kristen said, Beckett's been 9 days. As soon as he got behind our shed, he disappeared into thin air. Not a feather could be found. We think someone found and took him. He couldn't fly higher than 2 feet high. Oh, I'm so sorry, Kristen, honey. Well, I mean, I tried to be optimistic and I try to be hopeful. And I'm so sorry, honey. So it isn't likely he got too far from the house that quickly, because he was just a baby and he was doing so good. He was doing so good. I'm so sorry, honey. I'm so sorry. I'll be postering his picture all over the place. Found, please return him back home. Missing, this is my fur baby. If you got a picture of him, like with Summer Wells, put some pictures up, posters or something you could print off the computer that's got his picture on it. Hey, have you seen me? My mommy wants me back. Have you seen me? I mean, it don't hurt to try. That's a little bit of awareness for you. It's worth a try. It's worth a try. I hate to hear that, darling. I really do. And I bet you, what's his name? Pickle is missing his buddy too, ain't he? I think his name's Pickle, isn't it? Your other one, Kristen? I'm so sorry, sweetheart. Prayers. Sorry, darling. Bless your heart. But yes, thank you guys so much for coming in here. I'm getting ready to jump off here because I actually, and y'all say a prayer for me because tomorrow I have a counseling appointment in the morning, and it's my very last counseling appointment with my counselor that I've had for years. She's retiring Friday, and so I see her tomorrow, and I'm gonna be like, this is gonna be hard for me, guys. So y'all just say a little prayer for me, please, because this is gonna be really rough for me seeing somebody else, because my therapist or counselor, whatever you call it, has been my counselor for probably like 4 or 5 years, and now she's retiring, and I've been used to her, and I can open up to her, and then now I'm going to be getting a new one, and I don't know. It's going to be rough. It's going to be rough. And I talked to them on the phone when they scheduled my appointment, and that was the only time they had was in the morning at 9 a.m. And I was like, well, I'll grab it because I want to see her before she retires, and she retires Friday. So, but y'all just say a prayer for me because it sucks when you see a new doctor, you see a new therapist, you see a new whatever you see, and you have to go through your trauma and the hell that you deal with on a daily all over again, it seems like, and it hurts, and it's painful because you're trying to work through it, and then you have to talk about it, and it's rough. So y'all please just say a little prayer for me, guys. Please do. I haven't met my new counselor. I don't know if I will meet her tomorrow or not, but I'm really dreading it, guys, because you get used to people and you can open up to them, and then they up and leave, and you get attached to them, and it just sucks. It sucks. And then now, it's kind of like the same if you get a regular doctor, you have to go through the spew all over again. Even though they're looking at your medical records, they still want to hear your side of the story. So it's going to be rough, especially my PTSD stories is extremely rough. Thank you, Kristen, honey. Thank you, guys. It's just hard. I mean, like I guess you could say I'm scared. I guess that is considered. I don't know if that's a phobia or not, but I'm petrified to see somebody new when you've had the same doctor for years, and to go through your hell all over again. Like they told me, well, she'll read over the notes, but then she'll want you to talk about it, or whoever the counselor is. And I'm like, I really don't want to talk. This sucks. I really don't want to talk about it because that counselor knew, that counselor knew. I don't want to start all over it because then it just affects you. I mean, I know that they're there to help you, but to talk about your trauma or what hell you've been through is very hard to do. Very hard to do. It's very hard to do. So I mean, I guess that I don't, like I said, I don't know if that would be a phobia, but I'm just scared, guys, because I hate having to relive all the shit and the pure hell over and over again when you have to talk to somebody new. Because some people, they might read your record, but they still want to hear it from you, and that's going to affect me, guys. I mean, I'm just being honest with y'all. I mean, I'm sure y'all been in that situation before, and it sucks, and it purely sucks. So I'm really dreading it. I don't know. Like I said, I don't know if I'll meet her tomorrow. I know I have a counselor appointment, my last one with my counselor before she retires Friday. So that's a little nerve-wracking for me. And, it kind of breaks my heart because you get attached. So, I have to let you guys know how, if I met her, or if I vibe or whatever. I have to let you guys, keep y'all updated. It's just hard. It's just hard, guys. Absolutely. She said it's scared because Kristen said it's scared because you have to relive and explain everything all over again. It hurts and it's stressful. Take your time, talk when you're ready to talk, not before they will understand. I'm just dreading it. It's just a dread, guys. I'm just dreading it, guys. Yeah. But thank you guys so much for coming in here. and supporting me. It means so much to me. It really does. But I'm hoping those phobias that we listed, like I said, we learned something new today because some of them I never even heard of. But I'm just saying this, if by chance you do, if by chance you do suffer with any of those phobias and it is affecting your daily life, please see your doctor so that way they can help you. Don't throw it under the rug, as I always say about if you suffered with depression or anything like that. Don't throw it under the rug because you want to be your best person. You want to be yourself. You want to be your best self. As in not better than nobody else, but I'm just saying you want to be you. And if that phobia is controlling you, or certain phobias are controlling you and you can't get out of your house, you're afraid to drive your car, whatever the case may be, afraid to go to the doctor, like it can affect you. So please seek help, support, somebody to talk to or something. I think that it would help a lot, you know. Hello, Amanda. Good to see you, darling. I hope you're doing well, sweetheart. Thank you so much for being in here. Make sure you hit the like if you haven't done so. But just say a little prayer for me tomorrow in the morning at 9 a.m. is when I'm going to see my counselor for the last time. And it breaks my heart, But I'm glad that she's able to retire and enjoy her life. But it just sucks when you get attached to people. It sucks. It truly does. But I'm trying to be optimistic, and I just dread going through all this junk all over again. But I love you, Pink Fan, honey. Thank you for coming in here, sweetheart. Thank you, guys. Yeah, like I said, just say a little prayer for me. I appreciate it. Yeah. Hey, BH, good to see you. Love you too, brother. Good to see you. Yes, much love and respect to all of you guys. Tomorrow I have an open panel, and Rebels have an open panel tomorrow night too. He'll have his open panel first, and then I'll have my open panel afterwards. So I have it already set up, and hopefully everything goes well with the appointment and all that. So I love you guys. Y'all have a wonderful night. Thank you, Amanda, honey. Thank you, sweetheart. And I will see you guys tomorrow. And remember, be kind to one another because you don't know what somebody's going through. So be kind. It goes a long way. And then, just, as I always say, just be careful what you say because, words, they can be forgiven, but they're not forgotten. So just be careful what you say. Be kind to one another. Support people up. Support each other. Be there for one another. Lift each other up. And, pray for one another. Just, all good vibes, guys. I love you too, Evie. I love each and every one of you guys. You'll have a wonderful night, and I will see you guys tomorrow, possibly on Rebels. His is first. I think it's probably like at 8:30 or something like that. And then I'll have mine after, probably between 10:30 and 11, depends on how long he goes. 10:30 and 11. I have it set up for 10:30, but just in case if he does go over, it might be a little bit after 10:30. So y'all have a wonderful night. Thank you so much for coming in here, and I will see you guys tomorrow, okay? Virtual hugs to all of you guys. I love y'all, and I'm praying for y'all. And, just be yourself, and everything will work out, guys, okay? I love you guys. Peace. Thank you guys again.